New York City is known as the melting pot, and every language is spoken here. Queens is the most diverse location in the world, right? It's one of our boroughs. And so we see pretty much every language spoken in the world, and I do mean that coming to our footsteps. Now, the quantity of each are going to vary, right? It's not like you don't get many that come in but you like there's some languages that you wouldn't think of are spoken and are needed, right? I'll give you an example. Hmong or Wolof are two languages that I did not know before I started working for health and hospitals, but we do get a decent amount of patients that are coming into ExpressCare looking for those services. The challenges with language services, I think, are multi-pronged, right? Each language is different structure, different characters. Some are symbolic, or others are, Romance languages. So they come with challenges in translating, in having those in front of using technology, having it in the patient's hands, right? You lose some things in translation. English doesn't translate perfectly to other languages, so you sometimes face that problem. Google Translate is great, but it's not 100% accurate, right? So you have to get in there. So that's why you kind of need, I see technology where, there's closed captioning all the time. I don't necessarily think that's all end all be all, because you sometimes need the human intervention. So the video connection to a translator is really important. Audio is a necessity in many times. And the supply of that varies from language and region, right? I think we're getting better in the world as we consolidate and the larger companies work to get there. But where we need to do a better job is integrating. Back in the day, most of these companies only did telephonic, or they had to build for an iPad and a particular app and just work with in person, right? So you have your setup, your environment, everything, right? They didn't really have to do too much work. Now, with telehealth being as big as it is and multiple companies out there, it's important to be able to work throughout the regions with different companies, different contracts, make sure the connectivity is there, and we're building a system that endures and gets the connections. To address one of your first questions, which is what languages do we speak, right? In New York City, our system, any given facility, if you go in physically, you're going to see at least three languages, English and Spanish, then you'll see one or two languages there. So in Queens, Elmhurst, where I went, Bengali is the third language, right? That's highlighted. In Coney Island Hospital, which is in Coney Island in Brooklyn, Russian is a language that's more dominant as a third language. If you go to Kings County, Haitian Creole, right? So on and so forth, right? Each facility is unique. 13 languages are the top. That's what we consider. So all of our work must be translated and available in the top 13 languages of New York City so that we cover all those locations and geographic